Sure. Our motivation in pursuing this research was really to follow up on plenty of observational data and even clinical trial data at this point showing some weight gains, weight increases after initiation of INSTI-based or integrase inhibitor-based ART compared to other ART regimens. So there's now been evidence from several observational studies, both in North America and in Sub-Saharan Africa, and there was recently a large clinical trial in Sub-Saharan Africa showing increased weight gain after initiating INSTI-based ART. So we were interested in looking at what are perhaps some of the proximal clinical consequences after weight gain that maybe clinicians would like to pay attention to and may be ripe for investigation with integrase inhibitors compared to other ART regimens. So when we looked at a clinical consequence, our interest was diabetes following weight gain. What we found was with some modest elevation that integrase inhibitors were responsible for an elevated risk of around 20% as a class of incident diabetes compared to NNRTIs. And this again is in ART-naive individuals initiating ART. PI initiators had a similar elevated risk as INSTI initiators, but there was differential risk when we looked more closely at different integrase inhibitors. So for those initiating raltegravir, there was almost a 50% elevated risk, and there the confidence interval did not include the null, compared to dolutegravir, which only had a slightly elevated risk with a confidence interval including the null, and elvitegravir, which had essentially a null association with incident diabetes compared to NNRTIs. I think clinicians need to pay careful attention not only to weight changes in individuals, but perhaps changes in glucose tolerance, tracking individuals' hemoglobin A1C, their other medications, and looking at potential metabolic changes in their patients after they've initiated integrase inhibitors. Of course, we're following up these analyses with other analyses looking at the contributions of weight gain to this apparent elevated risk in integrase inhibitor induced diabetes. So that's of interest to us, and I think that clinicians should keep an eye out for those kinds of results to look at what the mechanism might be for incident diabetes following initiating INSTI-based ART. Again, this is observational research. It's in a very large North American cohort, the largest North American HIV cohort. So it's roughly representative of the US population who's HIV positive. But that said, it is clinical observational research, so a little bit of caution needs to be used. We've done our best to account for potential confounders, including baseline weight. So people who may initiate with a higher weight may progress to incident diabetes faster than those who initiated with a lower weight, and if those people were differentially distributed across ART classes, that could be a confounding issue. We've tried our best to account for that by adjusting for baseline weight and by age, race, sex, ethnicity, HIV transmission risk. But again, these are not randomized trial results.